Let's head on over here now. Many countries have gone into lockdown to try and stop the spread of COVID-19. However, the number of infections continues to rise and numerous industries have experienced losses as a result. Researcher at the African Peer Review Mechanism, Dr. Misheck Mutize, joins us now to discuss the effects of COVID-19 on the African Free Trade Agreement, which was entered into force on the 30th of May last year. Thank you very much, Dr. Mutize, for your time. Perhaps maybe we could start with just a brief summary of where we sit where the Continental Free Trade Agreement is concerned.
Thank you very much for picking up on this very crucial discussion. So as we stand, as you correctly said, that the Free Trade Agreement has been in force now since the 30th of May 2019. So now we've got 54 countries out of 55 that has already signed to the agreement. But on the issue of ratification, which is the binding part of the agreement, when countries agree to start implementing the terms of the agreement in their jurisdiction, it's only 29 countries that have ratified to the agreement. But hold the implementation of the agreement, which is slated to start on the 1st of July this year. But with what is happening with the COVID-19, there are a lot of uncertainties because, as you know, it needs to be supported by functioning industries.
It needs to be supported by functioning industries, and we oftentimes hear African solutions for African problems. In times like these, what role does the Continental Free Trade Agreement play when we have flight restrictions internationally as well in terms of regional trade on the continent?
Well, I must say it is situations like these that inspired the establishment of the agreement for the continent to establish some form of self-sustenance, some form of self-reliance to make sure that we can be able to overemphasize, or to emphasize rather, inter-African trade. So COVID-19 has just added to a myriad of other challenges that the continent has been facing. You see what is happening on global trade. Global demand is generally subduing, and the issues of trade war, you know what happened recently on Saudi Arabia and Russia price war in oil. And that has got an impact, a very huge impact on the exports of African countries, which is mainly based on primary industries.
And there's a widely held view that perhaps the continent needs to industrialize a little bit more in terms of all the resources being here, but we produce them locally as well. Is there a fair assessment?
Precisely, that's very correct, because you see the kind of industries that have been prevalent on the continent has been mainly primary industries, which are, we want to call them suboptimal. So with the drive of the fourth industrial evolution and also the coming of high-tech industries, that must be the drive to be able to establish a manufacturing base that will be able to meet the demand that will be created by the free trade area. So without that, which has been the focus, those industries will only be able to survive under a tariff wars, which is not sustainable looking at where the globe is going, to establish some form of competition that industries will be able to survive on their own.
I'd like to pick your brain as a final thought, perhaps, on how countries like Liberia and Sierra Leone, for example, dealt with the Ebola crisis. We must stress that these are two separate, very, very separate things that we are talking about. But in terms of crisis management and how information was disseminated to communities, to talk about, how important this is, taking into consideration the circumstances on the continent, just taking those directives from the World Health Organization and adapting them to the continent. What can we learn from how those countries dealt with Ebola?
Well, I would want to approach it from a slightly different angle, because you see, before we draw lessons from the instance of Ebola, when the disease started, when it struck one of the Central African countries, the perception was that it was a national disease. And most people ignored the alarms that were being raised. And we also saw that happening when the COVID-19 disease started, when some presidents were even confining it to China. But before things went out of hand. So you see, when there is such a crisis confined to national borders, that is the time to establish international partnerships, because you look at how the Ebola crisis was contained. It was a number of partners coming together to be able to implement and educate the masses, and also to capacitate the health system and give some support to the economic system to minimize the shocks that we experience as a result of that.
Thank you very much for your time and making us understand all of that research.